AC separations of the shoulder can be difficult injuries. Some injuries absolutely require surgery, others almost never need surgery. But there's a lot of debate about the ideal treatment for a grade 3 AC separation. So in this video, I explain the pros and cons of surgery for this injury. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. So here's the question. I have a grade 3 AC separation due to a fall. I've been off work for 5 months. I went back to work recently and it separated again. My doctor asked me if I want to have surgery. Now, before I answer this question, please understand that this is not medical advice. The information I'm giving here is just that. It's meant for information and educational purposes only. AC separations, what we used to call shoulder separations, come in 6 grades. Grades 1 and 2, the end of the collarbone, the tip of the shoulder blade, are either still lined up or just barely off. Minimal damage to the ligaments there, and they do well. The challenge, now, long-term grade 2 AC separations sometimes turn to arthritis of the AC joint. That's sort of a whole separate discussion. Grades 4, 5, and 6 are very significant separations between the end of the collar or the tip of the shoulder blade, the end of the collarbone. And a lot of times that collarbone is either poked through the muscle or something. It has to be fixed. Grade 3 is sort of in between, where there's separation, significant separation, where it's basically 100% displaced, but not significantly poking through other structures. Now, for decades, the treatment was non-surgical, even in elite athletes. And people said, hey, that does well. And it can do well. But over the years recently, we've seen more and more of a push. It started with pro athletes and it's sort of worked down into very active people to do surgical treatment for that. And there's a variety of different reconstructive options to bring that down and basically rebuild the ligaments to hold the end of the collarbone in place. The acromioclavicular ligaments, the corticoclavicular ligaments, but surgical reconstruction to do that. And that's been based on complaints that people had long-term after, months later after the non-surgical treatment. And I've seen this with patients that came to me for a second opinion months later, similar to what this person is saying, whether that's it still hurts months later, they lack strength in the muscles around the shoulder. They can't use it as well as they want to use it, but they just aren't happy with where they are. And so there's been more of a trend in recent years, even before it becomes a chronic problem, to do surgery for these grade 3 AC separations. Not everybody feels that way, so it's an important discussion for you to have with your orthopedic surgeon. Preferably, you go see a shoulder specialist or an orthopedic sports medicine specialist that does a lot of AC joint injuries, and you can decide if surgical treatment is right for you. Now, if you have an orthopedic injury and you want to hear about options other than surgery, maybe other than cortisone shots, you can click the link in the description under this video. You can fill out the contact form and potentially schedule an appointment with me. I'd also love to hear your experience with your injury. Leave those in the comments below. Just understand, if you leave a question in the comments, I can't offer you medical advice, but I might answer your question in a future video. Make sure to subscribe to my channel. You can be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.